Akif, you've embarrassed me too much. Thank you very much, everyone. So I'm delighted with the studies that we have today because they are addressing new areas in the understanding of diabetes. So we heard about age, duration, frailty, glycemic level, microalbuminuria, as well as other factors. Now, we never in the guidelines looked into the impact of microvascular complications such as neuropathy or retinopathy, or indeed the impact of everything together. Now, an important regulation in Ramadan, regulations in general for fasting, there's two measures. وَلَا تَلْقُبْ أَنفُسْكُمْ إِلَى التَّهْلُكَةِ. So it means in English, don't throw yourself into jeopardy, which means is the safety, of course. So when we stress stratify, we want to make sure that we're not going to harm the kidney, the heart, the person, end up with nasty hypo or so forth. But there is another very important aspect in Quran for the regulation of fasting, which is the burden of the condition itself on the individual. And the ayah for this, وَعَلَى الَّذِينَ يُطِيقُونَهُ فِدْيَةٌ طَعَامُ الْمِسْكِينِ. So those who feel the burden, they can have the exemption and feed a poor person. So from that point of view, it's important to remember these points when we think of neuropathy. Neuropathy is not going to kill a person, but is it a burden? Does it impact on the safety of fasting, the frequency of fasting? These did not exist in the previous risk calculation. So the question we have as well, as we've seen, many people with one microvascular complications frequently will have another microvascular complication. So is the presence of 1 versus 2 versus 3 an issue or not? So we had the pleasure of doing this analysis, and it's just been published this month in the Journal of Diabetes and Endocrine Practice in the special issue of Ramadan. I'm very thankful for all the authors, and indeed very thankful for the editor of the journal who did a great job. So we wanted really to look into this. After all, we are talking about frequent complications in people with diabetes. Neuropathy is the commonest condition or complication in diabetes. In our surveys was 20.7%, 21%. Nephropathy is 10%, retinopathy 14%. Of course, once a person might have a problem, might have other problems as well. So we wanted to assess the frequency of fasting and the outcome of fasting in people with 1 versus 2 versus 3 of the complications. And of course, this again is a sub-analysis of the global survey that you've heard thoroughly today. The participants for this were 12,000 persons, of whom 10,700 or 85% fasted. So that's the rate of fasting in type 2 diabetes in our global survey was 85%. And we collected the data from those who were fasted. Again, here is the frequency of the problems that we saw in the study. Neuropathy was present in 18.5, nephropathy 9.3 in those who fasted, and retinopathy 12%. No microvascular complications was in 69%. I'm sure, of course, if we screen more thoroughly with the retinopathy screening and neuropathy proper screening, we'll identify a lot more of undiagnosed complications. So perhaps the none is not truly none. 1 microvascular complication was present in 22%, 2 in 6%, and the 3 together in the same individual in only 1.6%. So when you look into the impact on fasting, the odds ratio for fasting for a person with 1 complication was 0.86%, so i.e. reduced by 14%. But if they have 2, it was 0.46%, which means reduced by 54%. And if they have 3, it is reduced by 68%, as the odds ratio was 0.32. I'm sorry this is not very clear. I was hoping it would be clearer, but you can possibly assess that for hypoglycemia, for daytime hypoglycemia, hypo during fasting hours, any complication increased or almost double the risk of hypoglycemia, but there was no accumulative problem having 1 versus 2 versus 3 regarding the rates of hypoglycemia. However, when it came, this is symptomatic, so this you're asking the person, did you get hypo or not? But when you asked them, was the hypo bad enough and you broke your fast, it was clear to see the burden of 1 versus 2 versus 3, and definitely those who require to go to the ER department or the hospital admission, the severe hypoglycemia, you can see the very significant increase when people have triple microvascular complications versus 2 versus 1. So the burden was not in the incidence of the hypo, the burden was in the severity, the appreciation of the hypos, and of course, needing to break the fast. More or less the same pattern in hyperglycemia. And the definition of hyperglycemia here were symptoms or a recorded blood glucose of over 300. So again, it doubled, having any microvascular complication, doubled the rates of hyperglycemia, and again, breaking the fast because of hyperglycemia was related to the burden, 1 versus 2 versus 3, and again, the severe hyperglycemia needing to go to the hospital was 6 times higher in those with triple microvascular complications versus 2.9 in those with 1 microvascular complication. It was interesting to see the different elements of the microvascular complications. This will be thoroughly discussed tomorrow. I don't want to impact on this presentation of tomorrow, which will address the retinopathy and the neuropathy and the foot impact. So the key insights that we had from this study, it was the first to make us rethink that burden is an important factor, and it's not just the burden, it had an impact on hypo, on hyper, as well as on decision of fasting. And I reflect on this. I remember when I was much younger, my mother, rahmatullah alayha, she used to have significant neuropathy and not sleeping most of the night because of the painful neuropathy. So we all know if you're not sleeping, you're feeling pain, you're feeling tired, then your risk of hypoglycemia the following day could be higher, could accept your mood, could do so many things. So current risk calculators often focus only on nephropathy, and we need to address the other microvascular complications. This study showed us that the cumulative burden of all complications are critical risk factors that we need to consider, and each additional complication amplifies the physiological stress and susceptibility of metabolic events. Of course, we have to personalize the pre-Ramadan assessment and counseling, which means that perhaps in this opportunity, let's examine the feet, let's examine the eyes. So perhaps that passion for fasting will lead to more risk assessment for the person with diabetes in general and better screening for retinopathy and neuropathy and foot problems. Of course, we have to implement enhanced glucose monitoring for those who are considered at high risk, and definitely adjust the medication, not just based on the cardiac status or the renal status, but certainly other microvascular complications as well as started to think of the potentials of exemptions for some people with these microvascular problems. Having increased risk because of microvascular complications have really significantly been seen to increase risk of both hypo and hyperglycemia. And the burden was clear with the breaking the fast and the severity as assessed by admission to hospital or attendance of the ER. And with this, I thank you all and looking forward for any questions. I think I've managed to save a bit of time. Thank you.